As we continue to navigate the current challenge, our government, our Prime Minister, our leaders have asked for additional recommendations and suggestions to help the country move forward. And so I've stepped forward with a number of recommendations. At the outset, one thing seems abundantly clear, and that is we have to find a way to coexist effectively with COVID-19 until there is an effective treatment or cure. The dilemma is not simple because we could err slightly one way or the other, and the outcome could be catastrophic, either medically or economically and socially. At the outset, let me say this: I am not an economic or medical expert, but like many other Bahamians, I have ideas that I believe can be helpful in this fight. In appreciation for the current situation and the events affecting our ability to function and coexist with COVID-19, I would like to offer the following 9 suggestions. Number 1, we live in an environment where our economy is basically very, very stagnant at the moment. But I believe that there's a way that we can continue economic activity even if we have a lockdown or if we have severe restrictions. Option 1 is limited hours and curbside business that is conducted from online shopping. So in place of a full lockdown where there's no commerce going on or very little commerce going on, we should be able to allow persons to operate businesses within a particular window, let's say 3 or 4 hours per day, curbside only, with payments being made online and customers picking up curbside or having their products dropped off with little interaction with staff other than to receive packages. This would give persons a window to acquire items and do business while still limiting movement. Option 2, online shopping and delivery only. Online shopping in the US has increased over 100% during this pandemic. And although this is not the typical model for the Bahamas, we should consider it as a part of our strategy going forward. Companies like Amazon actually never ceased operation during the height of the pandemic, and they have continued operations even in total lockdowns. This is one way of continuing economic activity until further options become available. So we can have businesses that learn how to do business online, and there are deliveries, and so there's no interaction with staff. Secondly, my second recommendation is that we have a program of daily updates on average cases, hospitalizations, and remaining capacity. We need to know how many cases or hospitalizations are too much and what's within our projections for relaxing restrictions. We have to determine how many deaths are occurring from untreated diseases such as cancer, diabetes, stress, anxiety, depression, etc. Because although we are protecting ourselves from COVID-19 and it's very serious, if at the same time more people are dying from other causes because they are prevented from getting treatment from COVID-19, then we have to look at a way of balancing it. So there have to be some parameters that are available to tell us how we are doing and what the mortality rate is compared to COVID-19 mortality rate. I understand that the mortality rate is less than 1%, and if that's so, what is the mortality rate for diseases that are untreated? The next suggestion relates to, this is number 3, and this relates to food purchases. I believe that we can continue to have food takeout only and food delivery only. And basically it would follow the same concept as online shopping, where persons would purchase online and then these persons, their food would be delivered to them, or if there's curbside pickup, that's another opportunity. But in the case of a severe lockdown, it could be delivery only. Again, the focus would be on online ordering and delivery rather than persons going out to get food until it's deemed safer. Number 4, I believe obviously schools should remain closed until we reach the indicators that are spelled out that tell us when it's safe to go back to school. And these indicators can be broadcast, they can be distributed so that a determination can be made and everybody is aware of what the indicators are. The 5th suggestion is that the borders remain open for tourists. In Jamaica, the borders are open for all tourists, but they have a number of restrictions. For the Bahamas, I believe that we should open the borders, but have the requisite restrictions in place based upon a tiered strategic plan, which would begin with private boats and planes, Airbnbs, and private resorts, where guests are required to stay within the confines of their resort for their entire stay, and then they can be provided with prepackaged towels and sheets where the guests would change it themselves so they don't interact with local staff. Special modifications to dining could be instituted that would limit dining to either outdoor or packaged food that the guest takes to their room. They either take it to their room or they take it outdoors for consumption. Guests could also order from local restaurants, whether those restaurants are the Fish Fry or other restaurants, and the food is delivered to the hotel and is consumed in-room or outdoors on property. As we reach markers or indicators that tell us that this approach is working, then we can gradually relax it. But as I mentioned before, a country like Jamaica, they are operating under similar provisions and they have been able to remain open. Tourism accounts for 34% of their GDP. In the Bahamas, tourism accounts for 60% of the GDP. So if they feel that it's important to open, and to open while they are preserving life and balancing with the COVID, then perhaps we can consider the same thing. Number 6, any Bahamian who travels abroad must automatically quarantine for 14 days and be required to have a negative COVID test prior to re-entering normal activity in normal society. Number 7, whatever future restrictions are planned, and if there is a need for future restrictions, those restrictions should be tiered and segmented so as not to overly impact the entire island or islands, while keeping provisions in place or restrictions in place to help lower the spread and infection rates. Future lockdowns, if they are necessary, should be limited in nature and should include provisions for things like gas, food, medicine, and some level of commerce, as previously noted. Number 8, communication and technology companies. One of the things that happened in one of our previous lockdowns is that while we were locked down, the communications and technology companies were not able to do business. Many were unable to do business. So you have a person who is sitting at home and their work and their only form of communication is through their computer, their tablet, whatever device they're using, and they need parts, they need a power plug, they need something, they need a range extender, they need something, they need a laptop, and yet they are unable to purchase because we are in a commerce lockdown as well as a physical lockdown. If persons are locked down and their only means of communication or schooling is through electronic means, then some type of access or provision should be made for electronic and computer networking communication companies to continue to function via the model that I explained, the online plus delivery. Regarding lockdowns, it should be noted that the WHO has scaled back on its recommendations for total lockdowns. And it was noted recently in an excerpt from Europe that, and I quote it, it says, this disclosure came from Cluj, who I believe is the WHO head for Europe, said that the global health body believed that Europe can combat COVID-19 without full lockdowns now that authorities are better prepared and have gained knowledge about how to fight the disease in recent months. With the basic nationwide and additional targeted measures, we are in a much better position to stamp out these localized flare-ups. We can manage the virus and keep the economy running and an education system in operation. And that's from Europe. Some countries who've had relaxed approaches have been able to keep their curves flattened, and some have far lower mortality rates than countries like the United States and the United Kingdom. Israel has a mortality rate of less than 1%. We have to find an approach that works best for us. Now let's talk a little bit in number 9 about mortality rates and cures. It's been noted that a number of countries have successfully navigated the pandemic with much better results than other countries, even advanced countries. While what they have done may not apply from one country to another, I believe it's important for us as a country to study the success of other countries. As was noted before, Sweden never instituted a lockdown, and yet their mortality curve has significantly flattened. Their economy was much less impacted than others because it never shut down. Now, they did pay a price in terms of a slightly higher mortality rate, but if you look at their mortality graph, you would see that it is flattened and they are having very little impact even while they are open. Schools are open and businesses are open, and they don't even require masks. Now, their model may not work for us, but we should study and see what was it that they did that could possibly be beneficial to us. And finally, number 10, crowd events should be phased in based upon indicators. Any type of gathering, whether it's a church service, a funeral, a wedding, a sporting event, should be guided by the same guidelines. If there is limited spread according to the predetermined indicators, then these events should be able to resume accordingly and proportionately. For example, maybe 10 to 25% capacity. If that means a number or per person's limit based upon square footage, this should be spelled out and applied to all equally. I'd like to reiterate what I said previously in my last press release, and that is, while we may have differing opinions, we have to work together. We have to support our leaders. Our leaders are in place for a specific time. They're elected, and so we have to respect their authority, their position, and we have to work together. It's fine for us to criticize or hold them to account, but everything should be done reasonably and lawfully, because at the end of the day, I believe we are all working for the same purpose. We should continue to pray for, to give counsel, to give comfort, to share, and to work together. All of us, we should give to those who have needs. We should help those who are in a depressed state, those who are in a disadvantaged state, and do our part. Those who have, there's a scripture in the Bible that says that in the early disciples, it said that no one lacked because they considered that all things were in common. So I think that's the same attitude that we need to have. We need to look at it and say, well, we are all in this together, and if I have something, I'll share it with my brother or sister. Of course, we have to meet our own needs first, but let's share with one another. Let's share with one another, pray for one another, encourage each other, and let's try to keep it positive. So many people are spending day after day just complaining about the problem. If you're going to complain, prevent solutions, and also speak encouragement. Don't speak hopelessness and despair. Thank you once again for listening, and we hope and believe and expect that a better day is coming, and this is going to turn around as we work together. Thank you.